wiped out the next day. We're going to biopsy your muscle now, and then we're going to biopsy it the next day. So, all right, people signed up for this, and all long COVID patients experienced post-exertional malaise following maximal exercise, despite considerable heterogeneity in their exercise capacity. So some people went pretty long before they hit that level. Symptoms included muscle pain, greater severity of fatigue, and actually some folks had cognitive symptoms up to 7 days after maximal exercise. So that really, these people are really doing something here to participate. They measured mitochondrial respiration and metabolic signatures in skeletal muscle before and then the 1 day after the induction of the post-exertional malaise. So what are we going to find here? So there's some hypotheses. One is that amyloid-containing deposits in the circulation can block local perfusion. So maybe they're just not perfusing. So they studied whether the amyloid-containing deposits were present in the skeletal muscle, and whether this was an indication of post-exertional malaise. They demonstrate that the concentration of amyloid-containing deposits was greater in the skeletal muscle of long COVID patients at baseline. Visualizing the amyloid-containing deposits together with the capillaries or lymph vessels revealed that these deposits were not in the capillaries or lymphatic vessels, but rather next to them in the extracellular matrix. So I want to point out, this was sort of that issue in that article I just read. They conclude that the post-exertional malaise cannot be explained by the hypothesis that these deposits are blocking vessel perfusion, causing local tissue hypoxia. So this part I found really interesting. If you're not already hooked, they found that a larger percentage of long COVID patients displayed small atrophic fibers and focal necrosis, which increased significantly after exercise, indicating an exacerbated tissue damage response in patients with long COVID. So when we put patients through this, when they say, oh, you just got to push through this, they're actually seeing that you are causing necrosis in the muscles of these folks. So this is not just harmless. So that whole, you got to exercise yourself back up, all those physical therapy and people with this post-exertional malaise, you're actually hurting your patients, by the way. So I know David Petrino's been pretty bullish on this finding, but that's the individual at Mount Sinai. But they explored the infiltration of immune cells in skeletal muscle upon this exhaustive exercise. They found more long COVID patients had these CD8, 68 positive macrophage infiltrates in the skeletal muscle. They went ahead and they asked this question, which I know everyone cares about. What about viral remnants? Are those playing a role in this differential immune response?